Good morning, good afternoon, and good evening. Welcome to the 967th day of continuous and uninterrupted Zoom session of IFPH. Let us start today's program with a silent prayer for a minute. Thank you. Today we have with us Dr. Jose Isaac, MD, former head and professor of Government Homeopathy Medical College, Trivandrum, Kerala, India, visiting professors at various foreign universities, former Central Council of Homeopathy member, former chairman, CCH Postgraduate Board of Studies, member faculty Homeopathy, Kerala University. The subject is before starting your practice. In fact, when we hear about this topic, it looks that it is needed for the experienced persons or not. But in fact, we all know that each and every case is a new incident, a new experience to each and every persons. That's the importance of this topic. So on behalf of IFPH, I am welcoming Dr. Jose Isaac, sir. Please, you can have the platform for the next 40 minutes. So to you, sir.
Thank you, Dr. Manoj. This is not a very interesting topic, maybe, but still I thought about this topic because whatever we see nowadays, and many people used to say that the youngsters who are coming out of our colleges doesn't have the confidence to practice homeopathy. And as you know that in the private sector, the jobs are limited. Everybody has to, do their own job or find out their own job by starting a clinic or something. At the same time, we know that in Kerala, around 20% of the students coming out of our BHMS courses are getting a government job like a medical officer or in the colleges or in research centers or something like that. But still the another 80% is remaining, where what we hear is the lack of confidence to start with. And normally everybody used to blame the institution or the teachers or somebody. Everybody finds some sort of excuses, or everybody wants to it is not to say that it is not their fault. That is the real thing. Actually, there are certain areas where we have to look into. I'm just putting this my suggestions and my observations before you all, because I know there are very leading practitioners and senior persons in this forum who may be able to contribute something, and they can also express their own opinions, because these facts should be addressed one day or the other, because it cannot go like this for a long time. How to instill confidence in the new pass out students who are going into the public and trying to start a clinic or something. What they need is, as I told you earlier, that there is a lack of confidence. And partly our curriculum, syllabus, all have some lacunas here and there. But I cannot blame the syllabus, because one time I was in the committee and I was also part of that to develop this kind of a syllabus. But when we look into everything, what we see is there is one more thing which you should not forget is our previous generations studied not in colleges which have so much of facilities or anything, but it produced great homeopaths. And they were the ones who developed a foundation for homeopathy in Kerala as well as in India. And because of them, the homeopathy developed a lot here. Of course, homeopathy stands in its own principles and everything. And that is the the spinal cord of homeopathy. But still, we can see this. Then, as the time goes on, what we can see is the number of doctors are increasing from every system of medicine. And in a state like Kerala, we can see that every 2 kilometers, there is a doctor. This is the situation now. It was not like that some 20 years or 25 years back or 40 years back. At that time, many people came to a doctor because there is no other way, or there is no other doctor nearby. There will be only one doctor in 10 kilometers or something like that. But now it is changing, and people are looking for people who are postgraduates or which specialization they have. This is happening in every system of medicine. We can see that even in allopathic system of medicine now, degree is not actually an accepted one. Everybody wants to go to the specialists. And things are changing, and the corporate hospitals are coming up everywhere. And these corporate hospitals, the hospitals were in the hands of the practitioners or doctors for a long time. And now it has all gone out of their hands. One more thing I have seen is recently, some years back, Indian Medical Association conducted a survey. And they found that only 8% of the children of the doctors are going to this profession. Only 8%. Previously, it was 35%. And another important thing is, to become a postgraduate in medicine, you need 10 years. Whereas after an engineering degree, you can straight away get a job in some computer company, software companies, or something like that. That also is another factor. And there is no technopark or anything that can give employment to 1,000 doctors or 1,500 doctors like that. And one more thing is, the doctors are not retiring. All the retired hands are also practicing and working in hospitals and all. So these new entrants are finding it difficult to start a clinic of their own, etc., etc. But at the same time, there are certain other factors which we have to look into. Because some years back, around 40 years back, when maybe most of the people in this forum knows, there's our Krishnadas Menon doctor, who wrote a book on practice of medicine. And he was telling me that when he finished his MBBS, he started a clinic of his own. And now his students are not at all starting any private clinic. And then he said that now we don't find any private clinic run by a doctor anywhere in the cities, because everywhere there are corporate hospitals, and the whole thing has shifted to the hospitals now. So this is the situation now. And one more thing is, this is one situation which helps homeopathy and the homeopaths who are coming out of our colleges. Of course, when they study in the colleges, 80% of their time is devoted to the study of non-homeopathy subjects. Like in the first year, people are concentrating on anatomy, physiology, biochemistry. Second year, people are concentrating on pathology, preventive medicine, jurisprudence, etc., etc. Third year comes surgery, and next practice of medicine, gynecology, etc. So here the study of the homeopathic subjects is limited to 15 to 20% of their time, or the students are spending only 15 to 20% of their time during this 5.5-year course for the homeopathic subjects. This is true everywhere. Throughout India, it is like that. Because to pass examination, they have to concentrate on the subjects which they have to study more. So that is there, of course. It's all there from the very beginning. I was also a BHMO student, so I know that from the beginning. In our time also, it was like that. I'm not blaming anybody. I was also like that. Anyway, another important thing we have to start is, see, many people or many students, they go to the mechanically, they go to the clinical side or the hospital side, sit in the OPD and see what the doctor is prescribing or what the teacher is prescribing. But nobody follows that one case from the beginning till end. This is one of the greatest mistakes. Any case which they take interest on, they should see how it started, or from where, which medicine it started, and how it progressed, and how the different prescriptions came on different stages, and finally how the patient got a complete cure. So from the beginning till end, they have to follow a case. Many times it is not happening. Even though our clinical study starts from the third year onwards, this is more a mechanical way of going to the clinic and sitting there and all. But they should concentrate on, I'm not saying that they should see all the 50 or 100 cases that are coming to that single OPD. It is not possible. But at least if they can study one case a day, that itself is enough, because our clinical study starts from the third year and ends with the house surgeons. So there is a period, a 2.5-year period, around 900 days, where if they study one case a day, by the end of the course, they will have at least studied 1,000 cases. But it is not really happening. So this is one area where things are, this is the time when they have to gain confidence and they have to see cases, and they should focus more on the clinical side rather than on the books and other subjects. The clinical training, because while I was in CCH also, I visited many colleges, and the biggest weakness lies in the clinical side. Because clinics means just go there, sit there, talk, and go out of this. This is not the way. So that's why I said it should start. If anybody wants to practice homeopathy, they should start from the day one on the third year and make sure that they see at least one case a day and follow that case until it is cured or whatever is happening, whatever it is. Because now the things are changing. Why I say the things are changing is because of the mushrooming of the corporate hospitals, modern medicine doctors cannot start a clinic of their own. And still see, like in foreign countries, they have a family doctor. The first place the patients go is to the family doctor first, who knows the person, who knows the history of that, his all ailments and everything. And only if he refer to a major hospital, they will go. Like that, here what is happening is, nowadays homeopathy, because of its economic, it is economic, because it is safe, and because it is available everywhere. The medicines are available everywhere in the world now, and you can get it through many marketing agencies. And because of that, a new interest is coming to homeopathy. And that too, homeopathy is slowly becoming the first line of treatment. That means whenever somebody has a problem, the first doctor whom he goes to meet is a homeopathic doctor now. It's happening everywhere because people are looking for treatments which doesn't have any side effects, which are economical, which because you know, the hospital managements and everybody, they are just pushing people to do all the tests, like laboratory tests and scanning, MRI, everything. And we all know that around 70% of these investigations are unnecessary or just to make money only. So people are becoming more and more aware of it. So he just wanted to go to the nearby doctor to see what it is. And there we can manage around 60%, and even 80% or 90%. So this is the area where every homeopath or every new entrance to this field has to concentrate. And from there it goes, you know, if they need further investigations or further some hospitalization or anything, they can direct the patient to that. So this is one area. Then another important thing is which book these new doctors are following. This is a very important thing, because we all know that there are ever so many materia medicas, ever so many books coming every day to the market. And most of them, you know, in the last 50 years, I don't think anybody has done any clinical proving or medicine proving. Nobody is doing that. So from where these materia medicas are coming? These materia medicas are coming from the information collected from the different materia medicas, and they are just compiling the information given in the different materia medicas into one book. And that book is studied by the students. This is one of the greatest problems. How many of our new entrants have an Alinsky note, or even an organon, or the Nash leaders in therapeutics, or the Ken's lectures on materia medica? Why I am saying this is because, you know, one time Calcutta was the capital of homeopathy. And at that time, many of the teachers were direct students of Kent, like Dr. B.K. Bose and all those people. Because my father also was one of the students of the Calcutta Homeopathic Medical College in the very beginning. I know what was happening there. And many were, the doctors were recommending only the books of the authentic authors or people who had practice. Because once you hear somebody, you know, there is the academic level, what they want is, everybody wants more knowledge. But in the practical level, what we need is the applicable knowledges, which is applicable in day-to-day practice. So this knowledge cannot come from just these compilations or studying all the symptoms of a materia medica. That's why some others say soul of the drug should be known. And more things are to be, you know, studied and go deeper and deeper into that. Even our repertory. I don't know how many people have the original Alinsky note with them. I don't know how many people have the original Ken's repertory with them. And now, you know, Ken's repertory originally had only 68,000 symptoms. And now the Ken's repertory that is coming in our softwares have more than 130,000 symptoms. The more the symptom, the better. That is the idea. But it is not so. If you have only one drug in a symptom, less headaches, that is the medicine. But now everybody is adding medicines to all the symptoms by saying that it was in that book, in this book. They just say compile, and really create more confusion. So the first thing one should know is they have to select the books they have to study, especially in homeopathy. Because in olden days in India, we know the parents used to select the guru for the child, a man who can give them wisdom, knowledge, everything. So these books has a great role to play. So my suggestion is to go to the roots, go to the real Alinsky note. Now, because why I said real Alinsky note is that because there are a lot of manipulations being done, rearranging, rearranging, adding, all these things are done, and the real one is difficult to get now. That is the situation. So this selection of the books, what they want, they have to decide, go for the authoritative authors who had good practice. That is a very important. Another important thing is, even this homeopathic philosophy, the organon and the 5 philosophies which we teach in the colleges, at least read this organon once in 5 years, so that when your knowledge increases and when you go to a higher and higher level, you will have more questions and queries on many topics. And the answers are there in the philosophy and in the organon. So that helps us to go to the next step later. Because once when you start practice, people may come just because you are a new entrant with us minor diseases. But after practicing for some time, more challenges will come to you. More difficult cases will come to you, because people become more confident on you, and they expect more things from you. So the responsibility of a practitioner increases day by day, and the more he has to go up the ladder. Here, the main thing is when we see very difficult cases, which is nowadays we know that a lot of suppressions, and after 40, many of the people are taking many tablets for many diseases like hypercholesterol or hyperglycemia or hypertension, like that hyperthyroidism, like that we can see a lot of diseases. And one problem which is there is when we study or when we look into a book, we have only the picture of that single disease. We don't know what is happening when 5 diseases are there together. That kind of teaching is not there. Because 5 diseases, if it is there, the combination of the symptoms that are coming up will be different. Only homeopathy can teach or manage this type of things. Because, in another school of medicine, one medicine for cholesterol, one for hypertension, one for hyperglycemia, one for hypothyroidism. Like that, they give one after another, one or more medicines, and each one for different diseases. But our thinking and our holistic concept ask us to give one medicine for all these 5 diseases together. So there, what we need is, we need to know the soul of the case. And in practice, actually the treatment of chronic disease and acute disease is different. Acute diseases are a different management. Chronic disease needs different management, as told in the organon. Even acute diseases also, many people don't know where to look for. It is clearly given in our aphorism 5 that in acute disease, look for the etiology and symptomatology. If you can't find the correct etiology, you can go for the symptomatology. So these are the 2 angles of prescription which we see in acute diseases. Acute diseases, as you know, fever, diarrhea, headache, like that, so many acute diseases can come. And also there is one more thing. Most of the patients who are coming to us, around 60% are coming when there is an acute problem, not when they are in the free period. They come with a problem. And that one maybe usually 60% of the cases, it is an acute problem. And they need a solution for that as early as possible. So here, the main thing what we should know is the management of acute diseases and later the management of chronic diseases. And one more thing is how homeopathy differs from other systems of medicine is, homeopathy is the only system which can cure chronic diseases. You know that anybody who's taking diabetic medicine, cholesterol medicine, or hypertension medicine, or hypothyroidism, or hypothyroidism, or some psychiatric problems, they are not cured. They have to take the medicine for lifelong. So what is happening now is slowly a shift is taking place throughout the world, and the people are looking for curative system of medicine. Many patients who come to me from the outside India, from overseas, their question is whether you have a treatment for this or that. I'm taking this tablet for a long time, and I wanted to shift to another system because I know that these tablets cannot cure me at all. And finally, most of the diabetic patients die of kidney failure, and other patients die of liver problems. You know, we all know that in Kerala also, the number of dialysis centers are increasing day by day. The number of sterility treatment or infertility treatment is increasing day by day. And the number of autistic children are increasing day by day. All these are pointing towards a shift. People are looking for an alternative. And the first among the alternative is homeopathy. And again, coming back to this topic, one more thing is, to the new entrants, those who are starting practice, what I want to tell them is listen to the patient. This is what is said everywhere. Listen to the patient means you give a patient hearing to the patient. So that many cases what happens is they themselves give us some clue for prescription. Because sometimes people come and say that they have such and such a disease. For example, a patient who is having constipation. He is coming for that problem, but at the same time, when they start narrating the symptoms, they may say they have a nose block also. That nose block gives us the clue for the prescription. Constipation with a nose block, the main remedy is Nexomica. This is what Bonnighausen says. So we have to know the different methods, like Bonnighausen's method, Ken's method, then Hughes' method, H. Roberts' method. All these methods will help us to treat diseases from different angles. Because see, we are all applying the law of similia. The similia can be applied in different angles and looking at the case. Then one more thing which we have to say is, we have to tell the patient what they can expect from a homeopathic treatment and how long they have to wait to see an improvement. Even PCOD, polycystic ovarian disease, which is very common now. And the other doctors can give only the hormones. And now people are becoming aware of the side effects of taking hormones or steroids and all those things. And most of the people coming to us are asking this question, whether you can do something without giving the hormones or steroids. So there we have to tell the patient that don't think that a change can occur within few weeks or a few months, because this growth or the cyst might have formed from after 4 or 3, 4, 5 years. And there is the psychotic miasm behind. All this we have to know. And about the investigations also, we have to know the investigations of the at least 10 to 15 chronic diseases. Investigations does not give us the remedy. Investigation results mainly help us in the prognosis to know whether the patient is improving or not, or going down or getting ameliorated or aggravated. But that helps very much because nowadays people want to see the results. Not like previous years back when the doctor says everything will be okay, patient don't believe that way. Now they wanted to know, because many of my patients, I used to tell them to undergo the tests every 4 months so that they can see some differences. Then one more thing is, many of us even forget to tell the patients about the general management. You know, at one point of time, doctors, we were taught the general management of each and every disease. Every disease. Then when more and more tests and everything came, modern medicine forgot this part of the management of diseases, and general management went back into the background in a way. But now it is coming back. Now most of the practice of medicine textbooks are giving more and more symptomatologies, explaining more on the symptomatology, because we all know that the clinical manifestations or clinically provings comes, or a disease is established only when it is established fully, these tests become positive. So they call it subclinical cases. Many things are there. And many things like, in corona, RT-PCR test. I know many patients who had some herpes zoster also were found positive, because it's a virus. It is not a specific test for corona. Those who had any other viral infection also were found positive. That is the situation now. So more and more, we all expect that more and more, these epidemics, pandemics are coming, and we have to face that situation. There, the only thing is, depend on the symptomatology. Symptomatology will give you the remedy. So these are things which we have to know. And another important thing is when we prescription, everybody thinks that many of my students also used to ask me what medicine you gave. Actually, they should have asked what medicine you give and on what indication. That is the most important thing. You know, in carcinoma, calcarea carb is one of the best remedies to contain the pain, everything. I have used it in many people and found very useful. One of my favorite remedies in carcinoma is calcarea carb. Of course, there is the psychotic remedy like Tuja, everything. But still, what we should know is on what indication a remedy is given. That is what we have to study in the clinics, not just what is the remedy. And one more thing is, acute relief can be obtained only by giving the correct potency in the correct repetition. And also one should know how to observe each case. As Hanuman said, what is curative in each medicine and what is curative in each disease? This is a very important thing. Because what is curative? Because, you know, in Materia Medica also, we have for sulfur 4,000 odd symptoms. And sulfur alone is enough to cover almost all the symptoms now. But still, we need other remedies. Why? Because the curative symptom, even in each medicine, should be known. For example, ineffectual urging for stool. Nexomica is the #1 drug. No other drug comes near this remedy. So we are not using many other remedies which have this ineffectual urging. Like that, better from flatulence, we are using lycopodium. This lycopodium covers 80% of the people who have this flatulence. So we are not going to other remedies in a way. Of course, there are other remedies also. Even carbovage, which has used for belching. Or even in a case like gallstone. We are using our gastric remedies mainly, like Nexomica, lycopodium, China. But China suits this condition because most of the gallbladder patients have severe bloatedness. And they used to say that if this gas goes up or down, I will feel better. And most of them have aggravation after the meals. So these kind of things, from the homeopathic point of view, how for even certain diseases, I won't say that this disease, this is the medicine. But for the symptoms of this disease, we have medicines. This should be the way. And one more thing important is, one should know how to manage the acute stage of a chronic disease. Many times we know that this gallbladder stone, one of the best remedy is belladonna. Belladonna is one of the best remedies for gallstone colic. But belladonna cannot actually dissolve the stone or prevent it from coming back or anything. It has its own sphere, it has its own use in a particular stage. And after that, we have to switch on to another remedy because managing the acute condition is different. And removing this condition, we need a different remedy. There comes the treatment has to go to the deeper levels. As Elizabeth Wright said, it is like peeling off an onion. We are removing the layers one by one that is put over this disease and this patient. And over the years, and many layers are there from the medicines he or she has taken in the past. That also we have to think about. So this way, removing the layers one by one and reaching the nucleus of the plot. And then to the constitution finally. So even now, when we treat patients, some very educated people will ask, okay, now my stone is no more, but still many people say that it can come back. Is there anything that can prevent? Because like in renal stone, the king of the stone or the remedy which is the king of stones is lycopodium. Everybody knows that. But we have other remedies like berberis, many other remedies. Then the question comes like this. One patient who has had 2 or 3 operations for renal stone, and every time after his operation, after 3-4 years, it is coming back. And this patient's question will be, okay, with your medicine, I have taken your medicine for 6 months, 1 year, and the disease, I know that the stones are gone. In the scan, I saw that there is no more stones, but whether it will recur after 3 years or 4 years, like when I did the surgery, this question will come to us. There comes our next level of treatment, like miasmatic treatment, constitutional treatment, etc., etc. So what I mean to say is, one should know what are the acute remedies, or if something acute is coming up in a chronic disease, what should be done? If it is not contained, maybe due to some other modalities or something, or exposure. For example, many arthritis patients, we know that the basic remedies are calcareous floor or medorinum or lycopodium or some apolycrust remedies. But still, sometimes we require some short-acting remedies like guaiacum, sometimes Restox, and even Ken's Materia Medica, Ken says that Restox will not cure arthritis. You have to follow it with a calcareous floor or a thuja or calcareous carb, like that. So this relationship of remedies, who is the youngest, who is the elder brother or the eldest brother, like that we have to know this group in a way in every disease or in every remedy. Because we know that even arsenic album, phosphorus is the complementary, sulfur can be the complementary, thuja can be the complementary, but in different conditions or different symptoms. Usually what we see is in asthmatic conditions after arsenic album, thuja works very well. But if it is in a stomach complaint, it can go to phosphorus. Or if it is a skin complaint, it can be a sulfur. So like that, every remedy, every polycrust remedy, the relationship should be known. How or in which condition this remedy or after this remedy where to go. Because many times what I have seen is, many people used to say that I have given Restox and initially it was very good, it worked very well. And then I started giving it for 6 months. And after that, it came to a stagnation. It is no more working. So there the problem is they did not go to the next related remedy, or they did not go to the miasmatic remedy. Sometimes all this chronic remedy, miasmatic remedy and constitutional remedy will be the same. That also can happen. So these are the things which we have to know. And finally, what I usually tell people are, because one doctor in Latvia, this doctor is an allopathic doctor. And he started reading our philosophies. He started with Ken's philosophy. He said it is a beautiful poem. Ken's philosophy is a beautiful poem. That's what he said. Then he read other philosophies. He got interested in it. And he knew that he went to many academies, studied from several places. Then what he said is, this is a treatment which is like a specialization for me. I'm practicing modern medicine for 15 years, and I have seen people coming back with the same problem again and again and again and again. Here, after giving allopathic medicine, homeopathic medicine, I have found that real cures are happening. I don't know why. I have just read all the philosophies. And can you tell me, when I look into, his question was like this, when I looked into the Materia Medica, I found 4,000 odd remedies. And I am already 45 years old. And I don't think I'll be able to read everything and study everything. And my time, I have only very limited time. That's what he said. Then, how to study all the symptoms of these remedies? 4,000 remedies and its symptoms. So that's a huge Herculean task which we cannot finish in one life in a way. So what you can recommend to me? Either you tell me your secret, or you tell me, show me a path on which track I should go. This is the question. This is the question which many people used to ask. Once you go into because when you read organon for the first time, it looks very simple. And everybody just read it like a novel or something. And every 5 years, when you read again and again, you will start increasing your knowledge, and you see that more and more things are hidden in this organon. More and more things are hidden. Even at this age also, if you read organon, you will see something which you might not have seen when you read previously, and which helped you in your practice, or you are reconfirming certain things which you have seen in your practice when reading organon again and again. So this is the way. So finally, coming back to his question, to study homeopathy, what to do? What he said is, studying homeopathy, I know that it is impossible now. But at least you tell me what I have to study to practice homeopathy. This is the question. Not to study the whole homeopathy, but what to do to practice homeopathy and to become a successful practitioner. So here the point is, look at our seniors, their prescriptions, sit with them as far as possible. At least go and sit with a senior homeopath who is doing homeopathy in a proper way. Then you can see, in my younger days, I used to go and sit with many doctors just to see what is going on, and in a way to understand their secrets in practice in a way. Actually, there is no secret in a way. Secret is their knowledge, which they acquired after years and years of study and practice, which you cannot get easily. And then what we can say? Finally, I told him an answer. You study 15 chronic diseases. You study the acute diseases, another 5 or 10. Concentrate on 25 polycrust remedies. These polycrust remedies means that remedies which can cure completely, and another 25 acute remedies. So with this from there, I won't say that this is the ultimate or this is the final one or something. But to begin with, even, when you practice, what happens is the number of remedies you are prescribing will go down like that. You will come to, you will come from 50 or 100. You will see that certain remedies, even though in the beginning may not give a good result, or something can give a long-term result, or something which can give a complete cure, and you will be slowly going to that. Even using the mother tincture, some people use mother tinctures. I'm not against any potency, because any potency can be used by homeopaths, and I think homeopaths should use all the potencies available in their treatment. But when you come to this, remember what a mother tincture can do, what a low potency can do, and next what we have to do. These are the things which we have to know. So my request to you is, identify 15 very common chronic diseases. Identify 10 acute diseases that comes to the college OPDs. Try to concentrate on 25 polycrust remedies, another 15 or 25 acute remedies. Then see one case from the beginning to end, not just one time. I'd like that if you can see one case from the beginning to end. When you complete your course, you will see at least 1,000 cases. Yes, because all our OPDs have good number of patients. So no problem. Okay, Manoj, you have already given me the warning. Okay, thank you. I'm stopping here. I want to get the opinion of all the stalwarts.
Yes, sir. That is most important, sir. It's a nice talk, and Of course, we have covered almost all important areas, especially for the beginners as well as those who are continuing the practice for a long time. And we all know that everybody in an outfits of dreams. So they cannot limit themselves. That's a problem. You just said about the limiter or how to limit or what is more important to get a comprehensive knowledge in homeopathy. Then a lot of topics are discussed. Time for discussion. Those who would like to participate can go to the participant list and raise your hand. You said about the percentage of people or the next generation who is going to the medical science is 8%, especially those who are getting a lot of income. In that area also only 8%. In the worldwide situation, only 12% of persons are sticking on the subject what they have studied. Only 12%. That is the worldwide situation. When comparing with that, I think homeopathy is in a sound stage. That I think. Now, Sridhar sir raised hand. Yes, sir, please.
Sir, it was a wonderful A to Z. You said that nothing to left for to say something, but still I like to say some of my experience. But I presented a paper in 1982, the South Canara 50th anniversary of these things. What you face when you come out from the college. That first time, those days. Now it is after IFPH and so many other associations, we are very frank to tell and clear the doubts. Those days they were not ready to tell and open it when we are started our practice. So I left to the place. I was having somewhat little practice, but I left and I went to join in a homeopathy college that in Punjab and Gujarat. There I learned how to repertorize. We were heard only repertorization. Only we got only 3 or 4 classes regarding repertory those days. That even that our colleagues who are the students who are studied along with me, they also know very well. Then I went and saw that how the results are coming. Even the teachers were not knowing, only very few were knowing that they may not be able to tell all these things. We must have to. And what I feel is that Sir told about to the Joseph told about to the no confidence. The Rome is not made up of one day. Like that, we must have to everyday practice. We will get confidence, but you must have a case record. I know some of the eminent doctors, they are not having case records. Without case records, how you can remember these so many thousands and thousands of cases? You cannot remember. Your confidence will not grow up. You must have case records and proper case taking, and that is the fundamental. And you must have that that you know that have an well-experienced person. You must have go and practice, not immediately start 4.5 years or 5.5 years. You must not start a clinic. You must have, and to have the others, seniors must have to allow the others to give some that the for experience. They must have to teach to the juniors also some practice. That I am not going. So many things I'd like to say, but most of the things that are covered, so I am not going. Thank you very much. Come, such a very wonderful talk. Please come again. Thank you very much.
Yes, sir. Now, Paris, sir, please. Please unmute, sir. Yeah.
Joseph sir, good evening and congratulations. You have once again proved your full talents in making presentations. Whatever be the topic, we expected this and you delivered it. The topic is coming under a fundamental category. More often than not, our doctors are not taking risk in presenting this type of topic, but due to your rich experience and full confidence, you could make an excellent presentation on this topic, evaluating each and every aspects in a full and beautiful way. I fully appreciate that, but I don't have the proper vocabulary to express your presentation. I am not capable of evaluating your presentation. That's it. He could analyze the evaluation, the problem involved as we anticipated. I have no word, as I already pointed out. I fully appreciate the presentation. and the contents and subject matter be included in the presentation. All the best, sir. Thank you very much. Thank you.
Okay. Yes, now Dr. Hubert, please. Yeah.
Hello, can you hear me?
Yes.
Sir, it was a very beautiful presentation. I would like to say that it is a beautiful presentation. Sir, I want to ask you, there are so many materia medica are there, but which materia medica you follow more easy with the practical way? Practice and there is practice and theory is there, but how the difference will be wide or short. Which one you prefer?
No, for
From your experience.
I think Alan's keynote and Nash. You know, in Nash, the advantage is there, he explains only 5 or 6 conditions in one medicine, and that is curable ones.
Thank you, sir.
And the thing is, you know, if you want to go further, you can go to Ken's lectures, where you will get a more picture of their disease, a picture of the patient. And then next to the clinical materia medica of Harrington, where you get the comparisons of all the remedies, different remedies. Actually, this is the pattern which was followed in the Calcutta Homeopathic Medical College in the 1950s, 60s, like that.
Thank you, sir. Thank you very much.
Okay. Yes.
Valuable information.
Yes. Dr. Dhanesh, please. Unmute now, Doctor. Yes.
Good evening, all, and good evening, Dr. Jose, sir. It's really one of the best presentations from you on this forum, particularly for the young generation, new generation doctors. But I would like to add some more points. But in the early part of our career, we used to have a very difficult time. Nowadays, things are entirely different because we have a lot of webinars going in everywhere, and we have lot of seminars by different organizations going on. So people, the new generation doctors got a lot of opportunity to know how to become a good practitioner. And even there are some schools which really mold out doctors into better personalities or better doctors. We have a lot of doctors who are training junior doctors in different parts of the world, particularly in India. We can see School of Changaran, School of Jawahar Shah, School of so many schools are there. It's schools of Saigal, like that, and even in Kerala there is a school named Sahia, which have more than 2,500 junior doctors attending their sessions also. This is entirely different from what we studied in the early part. In the I came out from a college where not even a single doctor having practice in those times. That is, they come to the college and they teach. Even though the college was so famous in those days, not even a single doctor having private practice, and they don't have any patient at all. We just saw some cases in our hospitals, which simply they manage with this remedy, that remedy, but they don't know why they prescribe that remedy. They are not able to explain to us why I give this remedy. That was a pathetic condition, but things are entirely different now, because when we started practice, we find a lot of patients around us. They came to us with the hope that we can do something, but what we do is just giving this medicine or that medicine, but by luck or by the grace of God, it clicked in a better way, and the patient survived with the good, and we got good results also. Frankly, I don't know why which medicine work in that way, but things really changed soon after. I got a book called Theory of Acute by Dr. I just forget the name. He's a famous doctor who just died during the pandemic, and that book really works, because in that particular book, only very short narration of each remedy. Yes, sir. Thank you, sir. Thank you for remaining the name. He has done a wonderful job in that, And that really enable us, even a junior doctor can study it very quickly. Even how you can differentiate what is the basic difference between belladonna, bryonia, gelsemium, and all those cases where simply how beautifully it is described within some 5 to 7 sentences only in that remedy, because you have studied everything in Boric and all those things in your college days. But how to choose the best symptoms, that is what Dr. Prabhu Vijayakar has done in that book, and that really that really helped me to build a very good practitioner in with the single remedy in acute conditions. So this is what I would like to add, that this kind of the things is the need of the hour to motivate our junior doctors, because there is the next generation is for homeopathy, and the next millennium is also for homeopathy. I think Dr. Jose sir is doing wonderful job in this not only in India but all part of the world. He's propagating homeopathy in a different way, and he's teaching doctors from other schools of medicine to practice homeopathy in a better way. Thank you, Dr. Jose sir. What's your opinion on my comments, sir?
Yes. So only limited time, Dr. Ganesh. Yes, sir. Joseph, sir.
Yeah, correct. It is like this. Most of the people, they study when they start practice because there is a need for it and they feel the pain.
Yes, sir. Yes, as rightly sir said, the textbooks followed is not the apt one. That's the most important problem, not only in the homeopathic medical college, but the allopathic medical college. And I remember once the students of the Ayurveda colleges gave a memorandum to the Vice Chancellor, Dr. Anandamurthy, to avoid Sanskrit from their syllabus. Around 30-40 years back. So
Nobody wants the original.
Yes, sir, that is the problem. The medical textbooks also, there's only a compilation. In modern textbook also, nobody studies the Harrison's principles of medicine, not the anatomy. Then the forensic medicine, all are compilation works, because that will may give more commission to the publishers or teachers. That may be the reason, especially with the arrival of the self-financing colleges, because what are all self-financing, they are depending others, but they are always self-financing. Then the said about the kind of purging is needed in case of teaching. In case of the clinical approach, you said about that the student never gets a proper follow up the case. That's an important thing. But who is doing all these things? That's another problem. Moreover, the quality of the teacher is an important factor. First, he should be a simple human being. That is most important. But that type of a connectivity is not at all there, especially in our medical colleges. They think they are somewhere some different species of. They never respond to even wishes good morning. You said they will not mind it. They will just turn back, whether this is to me or somebody else. I felt that. So that there is a proper connection is needed between a student as teacher. I was doing that job. That's why I am explaining all these things. Very sorry to say that also. Anyway, it's a wonderful presentation, and Jose sir, definitely we all know this entertainer. He has got all potential to fluently approach the subject. That's most important. Trying to wind up the session, may I invite our own Paris sir to express sort of thanks. Yes, sir.
Thank you. I'm very happy to take the responsibility of proposing vote of thanks to our beloved Jose sir. Thank you, sir. Thank you very much. I don't want to say much because the time is almost off. Thank you very much.
Well, that was the end of today's English edition. Hope you to meet the same day tomorrow. Till then, goodbye, and it's Dr. Ganesh for continuation program in Malayalam.